Does the COVID-19 vaccine improve maternal and fetal outcomes? And what role does herpes simplex virus play in Alzheimer's disease? This and much more on today's JAMA Editor's Summary. Hello, and welcome to our listeners around the world. Today is Friday, December 19th, 2025. I'm Dr. Kirsten Bibbins-Domingo, the editor-in-chief of JAMA and the JAMA Network. Today, I'm delighted to be joined by JAMA Deputy Editor Dr. Preeti Malani. Hello, Preeti. Let's get started.
Hi, Kirsten. We have some great content this week. First up, there's a population-level surveillance study about COVID-19 and the impact of vaccination on pregnancy outcomes, both for pregnant individuals and their infants. Dr. McClymont and colleagues included almost 20,000 pregnant patients who had COVID infection between April 2021 and December 2022. Then they looked at vaccination status as well as COVID-19 associated hospitalization, critical care unit admission, and preterm births. The investigators report that receiving COVID-19 vaccination was associated with a lower risk of severe maternal infections and preterm birth. They also report that this association remained regardless of the time period and circulating SARS-CoV-2 variants.
Excellent. As listeners may know, the herpes simplex virus, or HSV, has been implicated as a possible factor in the pathogenesis of Alzheimer's disease. However, what is not known is whether Valacyclovir, an antiviral medication used to treat HSV, provides clinical benefit for patients with early symptomatic Alzheimer's disease. Dr. Dave Anand and colleagues investigated this question in their Phase 2 randomized clinical trial, the Valacyclovir Treatment of Alzheimer's Disease, or VALAD trial. These investigators enrolled 120 patients with early symptomatic Alzheimer's disease and a positive serum antibody test for HSV1 or HSV2. The patients were assigned to receive either Valacyclovir 4 grams per day or matching placebo. The primary outcome was a change at 78 weeks in the 11-item Alzheimer's disease assessment scale, cognitive subscale score. The authors conclude that Valacyclovir did not reduce cognitive worsening and should not be recommended as a treatment for individuals with early symptomatic Alzheimer's disease and HSV seropositivity.
In his accompanying editorial, Dr. Nautman explains that this study is important because it refutes the idea that Valacyclovir plays any therapeutic role in symptomatic cognitive impairment due to Alzheimer's disease. He also comments on this general area of active study and speculation, the role of viral infections in the risk for and manifestation of Alzheimer's disease. There's also a research letter that addresses an important and timely women's health topic. Dr. Baker and colleagues surveyed 362 unique OBGYN practices in the clinician directories of 4 managed Medicaid plans on the California Department of Health Care Services website. The researchers used a script posing as a pregnant patient seeking an abortion. The authors report that only 4% of the listed clinics provided abortion care, and most did not provide abortions beyond 12 weeks.
Now, on to some more JAMA Women's Health content. JAMA published a thought-provoking viewpoint on pregnancy testing in the emergency department. Dr. Schiff and colleagues discussed the lack of explicit informed consent for routine pregnancy tests when patients present to the emergency department for any care. And Dr. Lau and colleagues have a viewpoint on the rise of restorative reproductive medicine, which does not include the entire scope of evidence-based fertility science, including assisted reproductive technologies. In another viewpoint, Dr. Hadidi and colleagues consider how much scholarly activity and research participation is too much for those in medical training or early in their careers, and when to consider quality over quantity of research. State-level efforts to weaken school vaccine mandates threaten childhood immunization rates and public health. In their viewpoint, Professor Gostin and Dr. Reese warn that relaxing these rules could bring back outbreaks of preventable diseases and urge strong advocacy for evidence-based vaccine policies. Doctors Zabone and Hayden report that a new Influenza A, H3N2 Subclade K variant is rapidly spreading worldwide and could cause a severe flu season due to reduced vaccine effectiveness. They urge increasing vaccination rates and the timely use of antiviral medications to help prevent serious illness and hospitalizations.
The latest JAMA clinical review is on head and neck cancer by Dr. Dunn and colleagues. This helpful review can ensure that you have the current information about the 7th most common cancer worldwide. Be sure to listen to this week's JAMA Clinical Reviews podcast as JAMA Associate Editor Dr. Margaret Wheeler interviews author Dr. Dunn. The podcast highlights that prognosis for head and neck cancer varies widely, with more localized disease having a 70 to 90% 5-year survival rate, and patients with HPV-associated oropharyngeal cancer experiencing especially favorable outcomes, while recurrent or metastatic disease has less than 20% 5-year survival rates. Let's listen to a clip of Dr. Dunn discuss post-treatment surveillance in patients with head and neck cancer.
So the surveillance following a diagnosis and treatment of head and neck cancer is well outlined in the NCCN, or National Cancer Comprehensive Network guidelines. Our patients following what we call a definitive or curative intent management all have a PET scan at around 3 months or 12 weeks following completion of treatment. And if the PET scan shows that there is no cancer, that the patient's disease-free, we continue monitoring the patient per the NCCN guidelines. We do not do routine imaging following the PET scan. We also check thyroid function tests at least every 6 to 12 months because the thyroid gland is in the radiation field for patients who've undergone radiation, and over time, hypothyroidism can develop. I do ask about dental cleanings. I also ask about the acute and chronic sequela of treatment, depending on what treatment the patient received. And then we do screen patients for depression and suicidal ideation. And then the last thing I should say, we do follow patients, usually 3 to 5 years per the guidelines, before handing our patients off to the primary care physician.
And this week, we also published a JAMA Clinical Reviews podcast about the new WHO guidelines on obesity medications. Kirsten, JAMA published these guidelines at the beginning of December. Now, you recently had a conversation with Dr. Francesca Zaletti, Senior Advisor at the World Health Organization, and Dr. Zeke Emanuel, Vice Provost for Global Initiatives at the University of Pennsylvania School of Medicine.
Yes, we had a great conversation. We discussed the guidelines themselves, the importance of the World Health Organization making recommendations about the use of these medications alongside recommendations for diet and exercise, but then also where the gaps are in the evidence and what we still need to know to most effectively treat patients with obesity.
Let's listen to a clip of that conversation.
The guidelines include 2 good practice statements and 2 recommendations. First of all, I like to say that the good practice statement, the guidelines are grounded in the recognition that obesity is a chronic disease and as such require chronic care, which needs to be lifelong. And so it is in that context of chronic care for obesity that WHO recommends conditionally the use of GLP-1 therapies in adults living with obesity, defined with the BMI, with the body mass index greater than 30. And also, WHO recommends GLP-1 therapy to be associated with intensive behavioral therapy that entails diet and structural intervention around physical activity. So this is the content of the guidelines, which are, of course, also completed by a series of implementation consideration and also broader guidance for member states and the general audience of the WHO guidelines.
We have a brand new JAMA Guide to Statistics and Methods article that I know are very popular with a big segment of our readers. This week, we have a manuscript by Drs. Caron and Rutnitsky about using observational data and reinforcement learning to find optimal dynamic treatment regimens. And the newest patient page is on avoidant restrictive food intake disorder. Learn more about this eating disorder that affects up to 5% of the general population.
Don't miss out as JAMA Plus AI Editor-in-Chief Dr. Roy Perlis and JAMA Associate Editor Dr. Yulin Chuen talk about the latest in health and AI on the JAMA Plus AI Conversations podcast. In this week's episode, they review the past year in AI and health and talk about what they hope to see this coming year. They discuss their favorite articles and what they might mean for the future of medicine. Let's listen to a clip from that conversation.
So one of the most cited articles this year was Physician and Large Language Model Generated Hospital Discharge Summaries by Williams and colleagues in JAMA Internal Medicine. And I think why this study was probably very popular is because it compared 100 hospital discharge summaries written by physicians with versions drafted by a large language model. And this is the year of large language models. And we're all looking to understand if they are going to be integrated into hospital systems, right? And so what the study did is they had blinded reviewers and they found no significant difference in overall quality or preference between the two. So we kind of keep on seeing that theme. They found that the LL summaries were more concise and coherent, but the caveat was they were less comprehensive and contained more errors, but the errors were mostly low harm.
There's also been a lot of rapidly developing medical news. Our outstanding JAMA Medical News team stays on top of it all and gets you the latest articles in clinical medicine, biomedical research, public health, and health policy. Find it all at jamamedicalnews.com or click on the link in this episode's show notes.
Thanks, Preeti, and thank you for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Kirsten Bibbins-Domingo. This episode was produced by Shelley Steffens, Ella Barnes, and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.